nurse today.
Hi, nice to meet you.
Nice to meet you. What's your name?
My name is Danny Ellington.
Nice to meet you, Danny. I heard from you, nurse, last night that you had an accident when you were playing football. You broke your right leg, bone went through your skin, and you also broke your right wrist. So you must be in quite a bit of pain right now. Are you okay?
But, I mean, compared to yesterday, I suppose.
Well, I did see in your chart that you've been getting hydrocodone and acetaminophen, which is opioid analgesic combined with an antipyretic. So that's just fancy talk for really strong pain medicine and a little bit of a fever reducer that also helps with that pain. So how would you rate your pain right now on a scale of 0 to 10?
Well, I definitely don't feel great, so I would probably say a 5 out of 10.
Okay. All right. Well, I can see in the electronic health record that you got your last medication 1 hour ago, so you have to wait a little bit longer. But what we can do, your right arm does look a little bit swollen, so let's go ahead and raise that. All right, to maybe help with the swelling, and that may help the pain a little bit. Okay. Maybe later we can try some ice. Okay.
Okay.
All right, Danny, I'm going to go ahead and do a little assessment of you. Just take your vitals, listen to your lungs, stuff like that, look at the wound, and we'll go from there. Okay, do you have any questions right now?
No, ma'am.
Okay. All right, Danny, can you tell me your full name and date of birth?
My name is Daniel Ellington. I go by Danny, of course. And my date of birth is January 30th, 2004.
Well, happy birthday.
Thanks. It's my 17th birthday.
Yes, that's an important year. Okay, Danny, can you tell me where you are right now?
I'm in the hospital.
Yes, okay. I'm going to take a picture, please.
That's a bright light.
I'm so sorry.
Uh,
Can you tell me what month we're in right now?
we're in January.
Okay. And who's the current president?
Joseph R. Biden.
Very good. Okay.
Junior.
Junior. Do you use any assistive devices to hear?
No.
Okay. Before this happened, do you use any assistive devices to walk?
No, ma'am.
Okay. All right. I'm going to take your temperature. And it's normal. It's 98.5. Very good. Feel for your pulse. Can't feel for this pulse because it's in a cast, but that one is good. You feel your pedal pulses.
What does pedal pulse mean?
Pedal is just fancy medical talk for foot. Push down. Push up. Very good. So pedal pulse is just checking the pulses in your feet, which are especially important to check for you because you have this cast on. So you got to make sure that blood flow is still getting down there.
Alright, that makes sense.
All right, and I'm also going to check capillary refill, which is just going to see how fast your blood comes back down to your toes after I squeeze them. And that's also really important because of your cast. Okay, very good on both sides. Skin is warm to the touch. Warm and pink, looks good. Same up here. This hand is a little bit cold, just a little bit cool. Got some swelling. Capillary refill is really good.
Thanks. Hey, Nurse Imhoff, can I ask you a question?
Yes.
What's this little contraption you've got me hooked up to? It feels like I'm in some kind of medieval torture chamber.
I see how it can look like that. This is your skeletal traction. So you've got some pins that are going through your bones. We put those there on purpose. And they are hooked up to a weight that's hanging. So basically what this is doing is it's keeping your bone in proper alignment and making sure that it doesn't move. Because if it moves anymore, it could cause undue damage to the bone and to the surrounding tissue. So this is just making sure that nothing moves and everything stays still and we don't cause any more harm to it until we can get you into surgery. And we can talk more about the immobility that this whole contraption puts you in, how we can prevent bed sores. So let's talk about that after our assessment. Remind me if I forget. Okay?
Thank
Okay.
you.
Mm-hmm. Okay. Get this ready. I'm gonna take your heart rate. Okay, very good. Heart rate is 64 and respiratory rate is 16, so that's really good. I'm gonna take a listen to your heart and your lungs, okay?
Thank you. Oh, that's cool.
I'm sorry. Okay, heart sounds good. Now every time I put my stethoscope on you, take a nice big deep breath in and out for me. Let's for those lungs. Very good.
Sorry, I didn't mean to hit your name tag.
It's okay. Out of your boat.
Thanks, these hospital gowns are surprisingly comfortable.
Mm-hmm. Very good. Okay. Heart and lungs sound really good.
Thanks.
Alright, I'm gonna get your oxygen saturation. So this is just reading how well your red blood cells in your blood are carrying oxygen. So we want it to be at least 95%. Okay. 97%, very good. Okay, let's take your blood pressure.
This is the one part about seeing a doctor or being in a hospital that I actually enjoy. It's like a hug for the arm.
It is like a hug for the arm. I'm glad this part's fun. The whole breaking your leg isn't too fun.
I know, that part was pretty bad.
Yeah.
I hope I can play football soon.
I hope you can too. Most likely you'll have to sit out for the rest of the season, unfortunately. Because big bones like the femur and tissues around it take some time to heal. But if, you cooperate with your medications and your physical therapy and all the other things you're going to have to do to heal, which I know will feel like a lot, I think it'll help you speed along the recovery pretty well, okay?
Can't play football the rest of the season.
I don't think so. I'm sorry.
Football is my life.
Well, maybe just for this brief chapter, you take a little break. We'd love to see you back out on the field again for sure. And I think you can get back out there as soon as you're healed up.
I guess I can explore other hobbies. I've always wanted to work on my cooking.
On what?
My cooking.
Cooking? Well, I don't know if you can cook from the bed. Maybe reading? Movie watching?
Maybe.
Crochet?
I don't think so.
Oh.
Isn't that a girl's activity?
I mean, I think any gender can do it.
Maybe because you're being such a good nurse, I'll give it a try.
That's right. $110/70. Very good. and I have some weird questions for you. Are you having any nausea or vomiting lately?
Oh man.
Okay. Any constipation or diarrhea?
No.
Okay. When was your last bowel movement?
Earlier today.
Okay. And how is the color and clarity of your urine? Is it clear? Is it yellow? Is it darker yellow?
It's pretty normal yellowish color for urine.
Okay. Have you noticed any blood or any sediment?
No blood, no sediment.
Okay. Do you notice any pain or burning when you go? Okay. Any increase in frequency or decrease in frequency? Just for a second. I promise to put it right back. You okay?
Yeah, I'm okay.
Okay. Alright, so now I'm just assessing your abdomen. I'm looking for any visible masses. It looks nice and round, no visible, or nice and flat, no visible masses. And I'm going to take a listen. See how your bowels are doing. Okay, sounds good in there? Alright. Just gonna have a little feel. Tell me if you have any tenderness or any pain. Okay. Alright. Feeling for any warmth? Okay, now I'm gonna look at the wound a little bit. Let's put your pillow in your arm. Back up here. Let's try to decrease the swelling in that arm. Those fingers are a little bit pale. Okay, so I'm looking at the wound right now. So the dressing is dry, intact, and clean. There's a little bit of blood, but that's to be expected. It's about the size of a quarter. I don't see any purulent drainage, any signs of infection, like redness, swelling, any of those things. The rest of the dressing is well kept and dry. Your right thigh is a little bit swollen, but that's to be expected right now. We're going to keep an eye on that. It doesn't seem to be causing any issues right now because you have a good strong pedal pulse in this leg, you've got good capillary refill, the skin is warm, it's the right color, so I don't think that's much of an issue. But we're going to keep an eye on it, okay? And we're going to keep an eye on this too. Alrighty? Okay. Let me just check this IV. So you have an IV to your left forearm. It's a 20 gauge needle inserted yesterday, and it's infusing dextrose 5% in water at 50 milliliters an hour. The dressing is clean, dry, and intact. There's no swelling. Tell me if this causes any pain. I'm inserting a little bit of normal saline. Any pain?
No.
Okay, no pain.
And just things like needles and going in my veins freaks me out.
I know. I'm sorry. Well, it's working really well. When I flushed it, it was perfectly patent, which means we can use it in the future. Okay, so it looks good to me. Do you have any questions, concerns, anything I can do for you before I go?
I don't think so. Thanks for taking care of me.
Absolutely.
Is this like a thing where after you see the medical person you get a lollipop?
Oh yes, definitely. It's one of those things for sure. Okay. This is your call light. I'm putting it right here. If you need anything, you just push it. If you have any questions, concerns, something's out of reach, don't try to move. Okay? I will come.
Okay, is it okay if I just take a quick nap
Yes.
before you come back?
Yes, you take a good nap. I'll be back in about an hour to check on you. Okay? Alright, Mr. Danny. Nice to meet you. I'll be back.
Nice meeting you.
Hello, oncoming nurse. I cared for 17-year-old Danny Ellington in room 1679 today. He has an open fracture to his femur, so he has a large skin wound on his right upper thigh, and he also broke his right wrist. His right leg is in skeletal traction, and his right wrist is in a cast. I noticed that his right fingers were a little pale and slightly swollen. About a half an hour later in my shift after my initial assessment, he called and told me that his right fingers were numb and tingly, and his capillary refill was very sluggish. The fingers were cold, so I called his provider, and she came and loosened the cast. Since then, his right fingers are back to having very quick capillary refill, good warmth, good color, and mobility, and he denies any tingliness or numbness. He was admitted yesterday after his football accident, which caused his current injuries. He has no known allergies and no medical history, and he was not taking any prescription medication before his admission here. The pallor and slight swelling in his right finger was worrying me, so I moved his arm so now it's resting on a pillow on his abdomen to help with the swelling. His vital signs are all good. His heart rate is 64, respiration is 14, blood pressure 110/72, temperature 98.5, oxygen saturation was 97% on room air. He's awake, alert, and oriented ×4. All his pulses are strong. Capillary refill is good in all extremities. His right leg is warm, and the skin is pink and appropriate for his age and race. However, there is some swelling in his right leg where that cast is. The dressing on his right femoral injury is clean, dry, and intact. There is some dried blood visible that's a little smaller than a quarter in size, and there is some drainage from the pins, but there are no signs of infection. His heart and lung sounds good. There's no extra heart sounds, no extra lung sounds, no difficulty breathing or coughing or any dizziness. His last bowel movement was earlier today. He says his pain is a 5 out of 10, and he is cooperative with taking his medications. His IV to his left forearm is patent, and he is using the bedside urinal. There are a few things I think are important to make sure to look out for during your shift. One, assessing for infection at the pin site and the open wound on the right femur, just because the pins go right into the bone, so we just want to make sure we're looking for any redness, any swelling, any signs of infection. Monitoring for contractures and osteomyelitis, which would present with a fever, localized bone tenderness, any localized swelling and redness at the site, so just watching out for that. Monitoring for compartment syndrome, especially since that started to happen earlier today on the right arm. Monitoring for fat embolism syndrome, so we're keeping it immobilized to prevent and monitor any changes in his mental status like restlessness, confusion, lethargy, and for petechiae in the upper chest and the neck, so keep an eye out for that. Monitoring pain every 2 hours is really important. His pain meds, hydrocodone, and the acetaminophen seem to be working really well. Wound care and pin site hygiene, of course, to prevent infection, like we said before. Changing his position frequently, hopefully every 2 hours if we can, maybe by moving him up or getting like a pillow under him a little bit without messing with the angle and the weight of the traction, and educating him on safe moving techniques to prevent skin breakdown due to immobility. So part of that is I think you should try encouraging Danny to do any quadriceps exercising, like squeezing his thighs, ankle rotations, using the trapeze to lift his hips off the bed every 15 minutes or so to prevent pressure ulcers. Helping him with his basic needs like elimination and food intake, making sure that everything he needs is right there around him so he won't try to get up or move. Assessing for constipation because he is immobile right now. If this occurs, you might need to contact the provider, maybe talk about a higher fiber diet, maybe give him a laxative, increasing fluids. Administering the prescribed antibiotics, he's on Ansef. Deep breathing exercises. I don't think he'll need an incentive spirometer, but just continue to check those lung sounds since he is immobile and he's getting IV fluids. High fiber diet. Frequent examination of the skin, teaching him about his treatment plan. He's really disappointed that he won't be able to play football for the rest of the season, so just talking to him about adhering to his plan of care and monitoring for any urinary elimination patterns that may become an issue.